Sonia, thank you so much for having me back on this program. This is my third time speaking at this webinar with the webQDA, and I always find it a privilege for me to speak. And today it's even more interesting because we see a lot of, people coming from many different countries, covering all the way from the Caribbean. I see one of my colleagues there, Dr. Christian Ekoto, and all the way to the Far East, and passing through us here in Africa and then Europe. And I know we are not several hours behind, between Europe and Africa, but it's just great to be here. Today I have decided to talk about a topic that I'm not actually an expert for, but it's something that keeps popping up when I'm discussing qualitative research or trying to do qualitative research. And sometimes when I'm discussing with the colleagues who are also into qualitative research, and these things keep popping up. And I felt like, okay, I think it is time that I spend some time to look into it and understand really how it is done. So what I'm going to share with you is something that I've tried to put together. And so I'm open to more input and more expansion of this idea of the advocacy. I come from the Adventist University of Africa, as it was mentioned to you. This university is one of the main buildings we have here on campus. It is mainly for graduate education, master's and the doctoral programs only. It's an heavily international university. In fact, our students here in Kenya who are part of this university are minority compared to those who are coming from outside. And so it is quite United Nations here. But with COVID-19, we don't have a lot of students. We don't have students on campus, so we are teaching online at this point. So in this presentation, I'm going to define what advocacy is. I know we all know the definition of that, but I want to have a definition that I feel will guide the rest of the presentation. And then we'll talk about why is advocacy important, specifically in qualitative research, and what challenges people face, and how should we do it in a very practical way. Before we can do that, we'll talk about the agenda. What is the agenda behind the advocacy in research, especially in qualitative research? So let's go ahead and define that. Advocacy here, according to Merriam-Webster, is the action of advocating or pleading for or supporting a cause or proposal. So when we're talking about advocacy, we are talking about making sure the outcome of our research is actually giving a voice. We are driven by giving a voice to those who don't have a voice. And this is actually something that drives qualitative research in general. We do qualitative research in many cases because there's something that is happening that is bothering us, and we feel called to do something about it. Unlike maybe quantitative research, and allow me to be a little biased, because in qualitative research, we're allowed to be biased. In the quantitative research, I may just do the research just to get the numbers and that's it. But many times when we're doing qualitative research, we are driven by something that we care about, people we care about, that we want their voice to be heard. So we are driven by the act of empowering. Advocacy is the act of empowering. And so basically what I'm leading to here is that when we do qualitative research, we need to be driven by the need to empower other people. And we're going to come back to this later. And I consider it an act of humanizing. Some of you who are in education, the field of education, and maybe in the other social sciences, you have heard of this concept of humanizing people, because society and certain cultures, certain practices have dehumanized people. And in advocacy, we want to rehumanize people, bring back their dignity if it has been taken away from them. So that is the perspective. We are looking at advocacy from that perspective. Why do we need advocacy? And here I want to start with the goal of qualitative research. When you look at some of these sources, they will tell you that we do qualitative research to address local problems. So we are doing research with people that we actually know. People in our workplace, people in our subdivision, in our town, in our city, people in our communities that have issues that people seem to ignore, and we want to do something about it. We want to give a voice. That means for qualitative research, we want researchers to be advocates, people who are going to give a voice. So if this is the goal of qualitative research, then it's a right to say that it is time to open up new spaces. It is time to decolonize the academy, time to create new spaces for indigenous voices. Those are always part of the people who are oppressed, who don't have a voice, because people always feel that they are lower than them. Time to explore new discourses and new politics of identity. We have issues of identity as we go through globalization. We have issues of identity even right now with COVID-19. I believe we will never be the same again after this COVID-19. So all these things need to come up, new concepts of equity and social justice. I think we have all been seeing what started in Minnesota, United States, that has spread all over the world now. People asking for more equality, more social justice. And these are issues that are very good to focus on as far as advocacy in qualitative research is concerned. We need new forms of critical ethnography where we look at certain practices that are acceptable in the community, in the societies, in the cultures, but that are no longer useful today. I'm thinking right now, for example, and please forgive me for those who may have some connection to that culture. I remember a student, one of my students, writing a paper just 2 years ago. I was still in the Philippines. It was an academic writing class, and usually ask them to write about whatever they're interested in because it's a general course. And this student decided to write on female genital mutilation. That was the topic that she decided to write on. And she happened to, I think, have come from a country where they have that issue. It is true that culturally speaking, it's something that is very highly respected, and everybody wants to make sure that their daughter has that. But research, medical research, has shown that there's a lot more damage and a lot more disadvantages that come, even the medical risks that come with that, than the cultural benefits and advantages that we have with that. Guess what? This is an area where qualitative researchers could go and collect those voices of the young girls who have been struggling a lot. Although it is something that is accepted, but the critical ethnography will guide us to show that, okay, things are not really, we should change this practice. I know the World Health Organization has been trying to push that to change, and some changes have happened, but it's not a lot that have happened. And so these are some of the things that advocacy comes in to help. We need to find new ways of connecting persons and their personal troubles with social justice methodologies. And so we're going to look at it from methodologies, but also from practical ways. What do you do as a qualitative researcher to make sure you are supporting people like that? So I want to say that conducting qualitative research is not just about getting certificates, as some people have become. It's that driven by just certificates, to make sure I have the largest number of certificates. It should not be just about that. It shouldn't be just about getting awards at the end of the academic year or special promotion. We know promotions, all these are good things, but it should not be the only reason why we're conducting qualitative research. And it should not just be about the money that we're going to get after we have published that qualitative research study. These are all good things, but they should not be the only reason why we're conducting qualitative research. If the goal of qualitative research is to make sure that we speak for those who don't have a voice, then we should go beyond these things. I want to posit that conducting qualitative research is and should be about how to make the world a better place and how to improve the lives of people. I like what Nelson Mandela once said, and now he's no longer. He said, "We can change the world and make it a better place. It is in your hands to make a difference." And I believe as qualitative researchers, we come with a certain authority to conduct our research. Because, hey, you have that degree, that PhD, master's, whatever it is, that you've already earned, and that qualifies you to conduct research and actually come up with data that people will have to try to listen to. And so we can change the world and make it a better place. And I think, if you look at even Nelson Mandela, when he wrote this, and he was in jail and everything, we know the whole story of South Africa, apartheid, and how it all ended. It's amazing. I know he didn't work alone, he worked with other people, but it's amazing what happened there, that when men and women decided to make a change in an area. So what is advocating? It is the pursuit of social justice. So we want social justice. When we're conducting qualitative research, we want social justice. We want to contribute to social justice, to giving social justice to certain people who don't have it. And this has to be done within a transformative paradigm. We need to care. We need to be intentional that we want to see transformation of lives, transformation of society, transformation of communities, transformations of systems, improvement of cultures. This is within a transformative paradigm, challenges prevailing forms of the inequality, poverty, human oppression, and injustice. If we are driven by changing this, then we are focused on advocacy in qualitative research. And I still believe that this should always be a central part of qualitative research. It should, maybe not central all the time, but it should be part of any qualitative research study. What are the challenges? We have time constraint. As most of us here must be faculty, we have so many things that we deal with. And now with COVID-19, we have to design the classes that have to be online and so on. So we have time constraints. And some of the advocacy requires commitment for a long time, where you don't just do something in one day and then you're done. Some of these things may take a long time. You may have to commit a number of months or years for a good cause. We have oppressive systems and cultures. You have systems where people are benefiting from their oppression or oppressing other people. And so you want to change this, you become a target of some threats sometimes, or you have cultures that everybody understands and accepts, like this female genital mutilation. I mean, the women themselves are the ones who are pushing and saying, if you don't get that mutilation, then I don't want my son to marry you. So the system itself makes it so hard. You want to change things and it doesn't work. We have a lack of support from the local leaders, lack of support of the university, if it's something that the university is involved in. Lack of support of even the oppressed people themselves. For those who are in education, you have read the book, The Pedagogy of the Oppressed by Paulo Freire, the Brazilian famous educator, who said that actually when somebody is being oppressed for too long, they learn to identify with that oppression, that they don't think that anything is possible beyond that oppression. And so you may want to change something. Even the oppressed people themselves will not want that because they are comfortable with the system as it has been running before. Complexity of the problem. Sometimes this has happened to me a lot as an international researcher. I saw this when I was in the Philippines, where I will try to go and do qualitative research. And I see things from a certain perspective, and the locals understand it much better. And so I think you should do this. No. It won't work because of this and this and this and this and this. And so when you come as a researcher, and this happens also as a faculty, university people, we live in our life surrounds the university. And when we go out there in a remote place, whatever country we're in, we find that we are not really that well connected. And you see the problem, you think you actually understand the problem, but it is much more complex than you think. Limited funds and resources is another issue, because if your research is not funded, you are funding it yourself, and you're just trying to finish it fast before you empty your pocket. You find that even if you have good ideas in your mind, they can't go anywhere because you don't have the resources to make certain changes that are going to impact lives. And then the last one is the limited knowledge. We really don't know how to do it. And I'm going to encourage you to dig deeper into this after I have shared some of my practical ways to do that. Let's look at the agenda. What is the agenda? We're looking at 4 different areas of the agenda for advocacy. The first one, according to Guba, making systematic contacts with political figures, the media, the professional press, and with practitioners such as teachers, health workers, social workers, and government functionaries. That is part of the agenda of anybody who wants to be an advocate for the participants, qualitative research participants. Showing how qualitative work addresses issues of social policy. We need to actually go to the government. And right now, I'm remembering a study that my former colleague, Dr. Araceli Rosario, some of you know her, for those who are from the Philippines, she conducted a study in the northern part of the Philippines, where it was, and it's already published. You can actually Google that if you put Araceli Rosario and put teen parents, teen pregnancies or something like that, and you put Philippines, you're going to get that article. And in this study, she wanted to hear the voices of the teen mothers, because it's a phenomenon. I was reading an article just I think a couple of years ago that was showing that the Philippines had some of the highest percentage rate of teen mothers in Southeast Asia. And so she wanted to understand what their life, how they live, and so on. And she used the photo voice as the main design for the study, and I believe you know what that is. And so she was able to capture the stories of these ladies, these young ladies, teen mothers. And I remember reading that manuscript as we were preparing it for publication. And I almost had tears as I listened to the stories. You see, when we look at teen mothers, if you come, and I think many of us on this platform have a Christian background. Whether it's Christian background or Muslim background, you'll find that the tendency when we have a teen mother is an attitude of condemning the person. judging the person. That is the first thing that comes to our mind. Before looking at anything else, okay, she is just 15 and she's already a mother. This must be a very bad girl. She's a bad girl. But we don't look at the other side. Sometimes we even stop right there at judging them. We do not actually even think that some of these may have been victims of rape, victims of things that went beyond their control. Whether they had control or not, how about we look at them, their current life? I know some people say, okay, they deserve it. That's what they deserve for not listening to their parents. But let's be realistic. Let's try to change that and try to imagine you are the one who were pregnant, if you are a lady and you happen to be 15, or you happen to be a young man who's 15 and now you have made a young girl pregnant and she's 13, 14 years of age. What would you expect from the community? Well, what you would expect is exactly what those teen mothers and teen parents expect from us. Unfortunately, we don't. And when I was reading this article, it was just melting my heart. And starting that day, I learned not to see teen pregnant women in the same way. I see them much more differently than what I used to. So what did she do in the advocacy? She worked with the local government. They were able to present their photo voice result. And they presented, it was a group of 3 or 4 different scholars. They presented that to the local authorities, and the local authorities, for the first time, their eyes were open to the real issue that these teen mothers were going through. And as a result of that, they were able to make a policy, and this is where we're talking about issues of social policy, to create a fund for scholarship of teen mothers specifically. So if that study had not been done, guess what? That wouldn't have happened. And so this is the kind of research we want to make sure that is part of our research studies. Critiquing federally mandated ethical guidelines for human subject research, and also critiquing outdated positivist modes of science and research. It's no longer just because we have 1,000 people who are affected, then we have a case for that. You know what? When we look at George Floyd case that started in the US just a few weeks ago, and how that has challenged the whole system in the United States, and that is spread all the way to, I saw some on the streets, I think of London, and they went to, I think, to Australia and Southeast Asia, some countries there. It's amazing. It was only one person, just one short video clip of 9 minutes, just started this whole movement that is going on around the world. And so we don't want to just say, oh, no, we need to have a trend and have millions of people who are suffering from a specific issue so that we can address it. It could just be one case study that shows what is happening, and we take it from there. So qualitative research is not and should not be value-free. So, oh, no, I'm not going to address anything here. You know, I just want to be objective in everything. No, qualitative research, according to Cresswell, is not value-free. It must focus on the agenda to make this world a better place and to improve life in general, and may I say human life. So we have different levels of advocacy. And as you do your research or plan your research, you need to see which level you're going to focus on. The first one is individual level, where you have just some individual that you feel that this person, their story needs to get out. Or it could be a group. It could be a community, a whole community. It could be at the national level. There is an issue, maybe there's a policy, there are practices, there are cultural things, practices that are just not right, and we want to do a study that will expose that. That would be good. And then we can have some that are at the international level. And so for whatever study you're planning right now, you can tell where it fits. You can do advocacy from any of those levels. But when you do advocacy, you have 3 groups that you'll have to deal with. And each group can have different challenges to deal with them. The first one is those being advocated for. These are the people, your research participants, and that you want to help. Again, as I told you, some of them may have been used so much to their oppressive practices that they face, the social injustice and the inequality that they're facing. They may have lived with this for so long that they have accepted it as the norm. And so that may start with some sensitization for them to be able to come on board with you. The other one is those who are advocating. These are the qualitative researchers. What is my agenda in conducting this research? How will I change the world? How will I change society when I'm doing this? Because if my mindset is about promoting myself, that's the only reason I'm conducting study. So that I'll get my promotion, that's the only reason why. So that I'll get the highest number of publications or presentations and things, so that everybody will know that I'm the best researcher here. If that's the case, then we have a problem right there. We need to go beyond that. And the other stakeholders are those being advocated against. Whenever we advocate for certain people, automatically we'll be advocating against certain people who have special interests. I remember talking to a colleague in the Philippines about 5 years ago, who had conducted a study in a remote village in Mindanao, that's the southern part of the Philippines. And she is a scientist. She heard that this specific village, people said that there are spirits, evil spirits that are making people sick, and they cannot function, and their whole body cannot function properly, and so on. And as she was looking at that as a scientist, she said, no, there's got to be some scientific link to this. It cannot be just evil spirits. So she decided to go and actually observe what was happening. And she discovered that this specific community, other communities were fine except that community. And as far as the locals, indigenous people were concerned, no, it must have been an evil spirit. That's why they focused on one community, not the other communities. She discovered that the river where they were getting the water from was coming from a mining site that was far up there. And so the water that was coming from there basically had mercury that was affecting the lives of these people. And so after using this water for some time, the people will get sick and they'll become invalid. And so she was enraged, she was furious. She tried to knock at some doors, political doors, and said, no, we don't want to be involved because there are multi-million-dollar companies that are involved in that. You know, if you want to do that, you have to go through them. And these guys, sometimes they can hire even somebody to kill you and so on. And I remember the last conversation I had with her, she was saying, I'm going to put it in the media, in the newspaper, so that once it's in the media, nobody can touch me anymore. Well, I don't know in the end how it has happened, but you could see that she had the passion for that, but she understood the stakeholders that she was advocating against, that it may not be that easy. She wants to go through the government. The government does not, because part of the people in the government would not want to challenge a multi-million-dollar company. So let's look at some practical ways. We need to develop an advocacy mindset. It has to be intentional in us, because first of all, if we do not think that it's necessary, we're not going to have it. It has to start with us. If we need to be the change that we want to see, according to Mahatma Gandhi, I think he's one who said that, you need to be the change that you want to see. We need to develop an advocacy mindset. From today, we can tell ourselves, whenever I do qualitative research, I'll make sure that there is a certain level of advocacy that I'm promoting. connecting the suffering to the resources. Some resources actually exist. And here I'm talking about people who are in Western countries. Those I saw people who are attending from Portugal and the UK and other, and those who are attending from the United States. There's a lot of resources out there that the government can give. But sometimes, many times actually, the people who are suffering, the people who are oppressed, the people who don't have any social justice do not know that these resources exist. And so as we conducted research and we discovered that, okay, this person did not manage to send the child to school because there is no, they cannot afford it. And then as a researcher, you're an educator, you're in a university faculty, you know that there's money in the government for students who do extremely well, who have a good GPA, but this parent does not know that. Guess what? Connecting that child, that person to the resources will be already a way to advocate for those people. Influencing new policies or revision of existing policies. And this is, again, going to the example of Dr. Rosario's work, where she was able, her team were able to help the local government create new policies that would help the people, the teen mothers. So look around, look in your community, in your school, in your university. What are the policies there that are oppressive, that need to change? And then you can work with that to get them modified or create new ones that will help the people who are oppressed, who are disadvantaged. Raising awareness about inequalities. Again, this is linked to the very first one where you develop the mindset, because if you do not have the mindset or advocating for people, you will not even see the inequalities that are happening. You won't. You will not. And to understand this very well, just watch some of the interviews that have been going on about this case of George Floyd, where I remember specifically one that was, they were asking, I don't know if it was a Senate hearing or Congress hearing in the United States, where they ask these rich top companies, how many of you expect that when you step down, you can visualize that either a black man or a black person or a woman will replace you as the CEO? There was extremely small number, I don't know if it was like 10, 20%, who raised their hands. The rest of them, it was obvious that they did not expect that it will happen. So if you don't even expect that, that means you're not even working towards that. So the mindset needs to be the first point, and then help raising that awareness about the inequality. Publish studies with the practical models, practical policies, practical frameworks. I know that when we conduct grounded theory, and that's like those who are strong must go for grounded theory. Sometimes we have a beautiful theory there, but it's like, okay, what is the application of this? And the people do not get to translate that into practical implications. But when we do qualitative research, you should always be able to ask our question, the question after we are done or by the time we are done, we need to be able to answer the question, so what? So what about my community? So what about my society? So what about the people who participated in my study? If we have not answered that question, so what? That means we are not advocating, most likely we are not advocating for the people we were studying with. You need to use qualitative research designs that support advocacy. I'm not saying that we should not use the other ones, but if we are driven by advocacy, then we should use these much more than the others. And here we have like critical ethnography. We have action research actually is also driven by this. I would say phenomenology can also help with this. Critical theory, all those critical theory designs that are within the critical research in general, they help it to raise the awareness of inequalities or social injustice that is happening. And with this, we'll be able to dig deep because we have the tools, the qualitative research tools that will help with that. And last, we need to promote advocacy through qualitative research in general. Whenever we conduct qualitative research, let's always promote advocacy. Let's make it intentional when we are doing this. So when we are able to work on these practical ways, I see that we will focus on social responsibility, and as eventually we are going to have community empowerment because we have raised the awareness of the inequalities, of social injustices, the oppressions that is happening. That is part of social responsibility. For us as scholars, we need to be able to support our communities, the communities where we're conducting our studies. And this is how we get to empower the people. Before I close, I just want to share this website with you. This is my website that has all my references there, my resources there. For those who want to know more about what I have been doing over the last 10 years, you can get some books. I have all my books there, and some articles that you can download for free. The articles cannot be downloaded for free, but the books are for some payment. And I want to share this with you, this Facebook group, Qualitative Research Teachers and Scholars, that is where I have a lot of my interaction about qualitative research. So you can always make comments there, you can post ideas, you can post questions, you can post resources that you feel can help both the qualitative research teachers and also those who are simply conducting qualitative research. The other thing I just want to share with you a couple of things, and then I'm going to close here. It is a conference that we're going to have. I know we are here for qualitative research, but online is also something big that is happening around the world right now. If you want to share some of the best practices you have there, okay, I was muted a bit. You can check this website and you can submit an abstract if you want to present, or if you just want to listen, you can just register there and they will be able to see you on August 10 to 12. Please join us. We have people, experts from many different continents and countries who will be with us. Please join us and let's share the pain together. We have something else also going on for certification for people who are struggling with the online education. Please just drop me an email if you are looking for that. But in conclusion, I want to give 4 points here. The first one is that we need to stop being self-centered when we are doing qualitative research. That, I think, this is something of culture that has developed as a result of so much push of universities on our publications, conducting and publishing research and presenting. That we want to count how many, we are required a certain number every year. In some universities, you really have a minimum number that you have to keep, to the point that we are driven more by that than being driven by how can we really help people? How can we make sure that people are the participants or the communities that we're working with, that they are catered for, the needs are catered for. We need to intentionally plan to advocate, especially when we are doing qualitative research, because if it's not intentional, trust me, it's not going to happen. We have to be intentional about that. The next one, we need to read more about advocacy in qualitative research, because there's a whole lot that is going on out there. In fact, in the book by Given, 2017, they have one whole chapter on advocacy research. They're trying to push it to become a design by itself. So it is important to continue thinking about that and digging deeper into that, so that we can truly make a difference in the lives of the people that we are involved with in our qualitative research. And the last one, go change the world, one person or community at a time. It is true that we may say, okay, you know, I cannot really change anything in my country, or I cannot change anything in my city, such a big city. But you know what? By changing the life of one person, that change might be the whole world for that person. And so let's start where we are. Let's see the needs that are there, and let's try to do something. That is community involvement that is expected from us in most universities. But let's do it using qualitative research so that we can really do things that have a research basis for it. And with this, I want to thank you so much. I'm ready for comments and discussions at this time.
Thank you, Safary. Sorry for muting you back there, but I was enabling the microphones for the attendees to make their questions or comments now. So if anyone would like to intervene. We have some comments in the chat window. I'm not sure if you can see them.
Okay. Yes, I do. I see that. I see that. Then let's see. How do you want us to do this, Sonia?
Well, if anyone has a question, I will ask that they would enable their microphones because it's easier to make their questions, or if they can leave it in the chat window, but it's always a bit hard to keep up with everything because we have some comments now.
Okay, all right then.
We have some comments from Abigail and Adrian and Patricia. I suppose Patricia doesn't have a microphone because she has left quite a long comment. So if you want to check that later.
Okay, let me see. All right. Are we reading the first comments here, or are we skipping that?
Sure, if you want to read them, sure, go ahead.
Yeah, so let's read that and then we'll get to, I'll start with the one here by Adrian, who said limited knowledge in conducting quality research is one of the issues that need to be given attention in formulating agenda, especially that quantitative research is the orientation of most universities. That is so true. That is so true. In many universities around the world, it is a serious issue because people still look a little bit down on qualitative research. But I want to say that things are changing. I remember when I moved to the Philippines in 2011, this was really heavy thing there. But as of now, and we have some people joining from there, they will agree with me that this is really changing. People are embracing qualitative more and more. And so, yes, we need to push qualitative research together with the advocacy. Abigail said, that is true, Adrienne. There is always this belief that quantitative research is better, easier, and lesser in value than qualitative research. Yes, those are misconceptions. And so what I have seen happening that really helps is to intentionally make it part of the university to enhance qualitative research, have seminars, webinars, now with the webinars, conferences and the publications. It has to be intentionally done at the university level. Because if not, we'll have just very few people who do qualitative research, and people will continue to nurture those misconceptions about qualitative research. As Gieson said, it's a very informative session. Thank you so much, sir. Kindly suggest me some books to understand more about qualitative research and mixed methods. I'm a beginner. I will say, go to this website here, myresearchcorner.com. I have written books in such a way that anybody, it doesn't matter where you are on your level, you'll be able to get it. But it does not address mixed methods. Mixed methods is a whole, people have made a whole field with that. It's different. Now reading from Dr. Patricia, greetings, Sandy, good morning, new place. We actually, Dr. Patricia invited me in Costa Rica, that is in Central America, for us to have 3 days training on qualitative research. And it was a wonderful experience. This is what she says. I applaud you, Dr. Safary, your wisdom in regards to qualitative research. I want to commend you for addressing such heavy loaded and sometimes underrepresented topic as advocacy. I celebrate your words in terms of empowerment and humanization. I agree with the challenges in regards to advocacy, mostly when you mention the lack of support. I know, Dr. Patricia, we have been talking about this and exchanging communication. I know exactly what you mean. This is a real tangible challenge, particularly in the workplaces where quantitative research is highly valued. I fully agree with you. University leaders that do not get quality research, they avoid it and even resist it. I just want to add my humble opinion as part of the practical ways to deal with advocacy, and it is simple: perseverance. I think that is a big one, and I'm going to add it to my presentation here with your permission. Anywhere where I have been successful in pushing qualitative research, it's not because it was just so easy, everybody was happy to move. Any change is always a challenge. What happened, and Dr. Patricia, you came to a conference in the Philippines 2 years, was it last year? I don't know if it was last year. I think it was last year. Yeah, it was last year. You saw what you saw. That was a result of persistence. Trust me, it was very, very challenging. And I have some of my colleagues here who were in the Philippines with me at that time. They will agree with me. The challenges that I faced, even in our university. And you wonder, why are people doing this? And yet there are just so many good things that can come out of this. And so persistence, yes, persistence will take you further into qualitative research goals. Also educate and provide knowledge to those who resist. Let them ask you questions and doubt so that you become a source of understanding and change. We humans tend to fear what we do not understand. If we firmly believe in qualitative research advocacy, it will show and change will come sooner or later. Patience will also come into hand. Thank you so much. That's a very, very well said, and I fully agree with you. Eliana says, some feedback I received is quantitative can represent a larger population, whereas qualitative represents small number of cases or participants. This is something, these are some of the myths that we debunk when we have a training on qualitative research. We used to have this 3-day qualitative research study. I have had it even with engineers, a group of engineers who just don't want to hear any word, they just want to see numbers. And after 3 days, they say, we cannot live without qualitative research anymore. It usually comes from people who have limited knowledge of qualitative research. And if you can encourage them to attend a very good training on qualitative research, I would say at least 2 days. And somebody who really knows qualitative research, who knows how to transmit the knowledge, trust me, things will start changing. I have seen this happen over and over and over and over again. I've seen mathematics professors doing qualitative research after these trainings. So it can happen. And to help them understand before the training, just ask them, because now the story of George Floyd is very well known worldwide. Just ask them, what do you think about these policies and even the millions of dollars that have been raised in the United States to try to change the system, the legal system in the United States against policing? And that was triggered by one person. Do you think it's not reliable data that people are basing all these things on only one case? Just right there, it will tell you that it's not about numbers. One of the things that I always tell people when I give the training, I tell people, because one of the things we talk about in quantitative research is this random sampling. And I asked people, I said, what is one of the major decisions that you make in your life? Well, one of them, some of the major decisions you make is what university to study and what to study. You have decisions like who you want to be with as your spouse for the rest of your life. So I asked them, how many of you did a random sampling about that? And right there, when we get to that question, everybody understands that, okay, not all the things that are worth supporting require large numbers or random sampling. Some of the things we just have to use even a small number and get there. What is the place of the local languages in connecting with those advocated for or against? I do not understand that. The person sent me a private message, so I'm not going to reveal your identity, but if you can rephrase that, I'll find a way to address the question. I think it's worth mentioning that the advocacy divide is not between quantitative and qualitative research. Quantitative research can be used for advocacy, that's correct. This one, we're talking only about advocacy in qualitative research. And the reason why I'm focusing on qualitative research for advocacy is that when we're interviewing people, we get to see the reality of their life. While in quantitative research, you know, I can come in with survey for 10 minutes, I distribute the survey and I'm done. I can even send an assistant to do that. But in qualitative research, when we're conducting the surveys and we do the observations, we get to dig much deeper into that. So if a quantitative researcher does not do advocacy, it's like, oh, okay, kind of understand, because they didn't really get the full picture because when they were there, because it was just a survey. But in qualitative research, all the time we're spending with people, we cannot spend 2 hours with somebody and they're telling you their stories and you still act as if nothing happened. So especially in the context where quantitative research is more highly valued, it's especially important that the quantitative researchers also see their research as tool for advocacy. Definitely, I agree fully with you, Megan. I'm not saying that quantitative researchers are free from advocacy. No, 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 no. But I think it is something that we should even take more seriously when we're doing qualitative research, because we hear the stories, we see the reality, we sit down with the people, we see those children crying of hunger, we see those homeless people, and to sit down with them and ask them how is life on the street. And they tell us the last time they ate was 3 days ago, which may not have been on the survey that we distributed to them. And so that is where we're coming from. I see another one that came from that same person, private note. What I mean is, should we not bring in languages of the people for us to advocate for or them best in the best way possible? I hope I'm getting this properly, that we should speak the language of the people we're advocating for, or that we should bring the people we are advocating for to the public. And listen, this is one of the assumptions that we find in photo voice as a qualitative research design. That one of the assumptions of photo voice is that the people that you are going to work with do not have a voice. That's one of the assumptions. And you want them to make a voice, but they don't have a platform. And so how do you create a platform for them? In a photo voice, you ask them to take pictures. And once the pictures are done, they come and display them, and then they talk about those pictures in the presence of the local authorities, the local community, to raise the awareness about the challenges that these people are facing. And so, because if you said, okay, we are going to invite everybody, we're going to have a conference, and the homeless are going to be the speakers, nobody's going to show up. And if they show up, they are going to come to mark them. But if you do it with the photo voice and you bring people in, so we have been doing a research, this is a university professor, let's see what research came up. And when they get there, they see these pictures, and then those people who don't have a voice, now they are explaining, this picture represents this in my life experience. And the people are able to hear the language, now hearing the language of the people that we want to advocate for. And so in some cases, yes, you may want to bring them if there's a way, and I can't think of any better way than photo voice. A photo voice, I think, is the best one to give, to allow the participants to actually speak to the public, and they don't have to be meticulous, because they are just using the pictures. As they say, that one picture is worth 1,000 words. And so they just show the picture and just have a little explanation because they didn't even learn how to do public speaking or anything like that. And so, yes, we can definitely do that. Back to you, Sonia, if there's another comment.
Thank you so much, Safary. I don't think there are any other comments in the chat window. I don't know if there are any questions. We have time for one last question. If you agree, Safary.
There's no more on the chat room, but
okay.
if anybody wants to speak for a minute or two, I think we still have that couple of minutes.
If not, I will start by thanking you very much for this wonderful session once again. It's always a pleasure having you as a host. We hope we can continue this collaboration in the future and have many more sessions like this. Sure. So if there aren't any more questions, we will close this webinar. Thank you everyone who joined us today. Hope to see you again very soon. We will share the video of this presentation tomorrow. So Safary, thank you so much.
Thank you so much, Sonia.
Take care.
Yeah,
we will see you soon.
Thank you. Thank you so much.
Thank you very much.
Stay safe, everyone.